Hello everyone, thank you for taking the time to listen to my presentation. Today I am going to be talking about Alzheimer's disease and the challenges it presents in an individual's life, as well as the role it plays in our job as paramedics. Throughout this presentation, we will go through some of the physiological and psychological changes that come with the progression of Alzheimer's disease. We will go over some of the social and family consequences that the individual or their family members may experience. And lastly, we will touch on some treatment options as well as challenges that Alzheimer's disease presents in paramedicine. Alzheimer's disease is a condition that impairs one's ability to function independently. Due to various changes going on in the individual's brain, basic things like thinking, making decisions, and performing daily tasks become a challenge. Due to memory loss and cognitive decline, Alzheimer's disease has a significant impact on the individual's social life as well as the people close to them. There are many different treatment options for Alzheimer's individuals that can help to stop the disease from progressing and lead to a more normal life. As paramedics, it is important that we understand the different aspects of Alzheimer's in order to provide the best care possible to all of our patients. In the next few slides, I'm going to be talking about some of the physiological changes that a person with Alzheimer's disease will experience. Alzheimer's disease is classified as the most common type of dementia. Dementia is an umbrella term that describes various diseases or conditions impairing a person's memory, decision-making skills, and ability to perform daily tasks. Alzheimer's is a progressive degenerative disease that normally occurs in people over the age of 60 years old. Studies have shown that approximately 25% of people over the age of 85 years old may be affected by Alzheimer's. The pathophysiology of Alzheimer's disease involves structural changes to the brain, the most common being cerebral atrophy. When the brain shrinks, there is a loss of neurons and their connections in the parts of the brain involved in memory, including the entorhinal cortex and the hippocampus. It later affects areas in the cerebral cortex responsible for language, reasoning, and social behavior. The decrease in brain volume is directly related to the severity of cognitive impairment the individual experiences. Brain atrophy occurs naturally as people age. However, in individuals with Alzheimer's disease, the atrophy is much more prominent and causes extreme changes to memory, thinking, and the ability to perform everyday tasks. In addition to cerebral atrophy, Alzheimer's disease causes amyloid plaques and neurofibrillary tangles. Amyloid plaques are formed by beta-amyloid proteins clumping together, which disrupt cell function by collecting between neurons. These amyloid plaques and neurofibrillary tangles interfere with neurotransmission in the brain, ultimately causing cognitive impairment. Now that we've went over some of the physiological changes with Alzheimer's disease, I'm going to be talking about some of the psychological changes a person with Alzheimer's may experience as their disease progresses. Alzheimer's disease primarily affects cognitive function and can change a person's thinking, actions, and social behavior. In the beginning stages of Alzheimer's, the individual will experience a gradual decline in the ability to remember things and will experience difficulty in making decisions. These initial changes may be observed by the person themselves or by others, such as friends or family members. Some people with Alzheimer's may be able to recognize their changes in cognition, behavior, and mood, whereas some people do not. As Alzheimer's progresses, the individual will experience increased difficulty in performing daily tasks and may require help. At this stage, it is common for individuals with Alzheimer's to get frustrated when people attempt to assist them with basic tasks. They may start developing more aggressive behaviors as they try to cope with what is happening to them. In the late stages of Alzheimer's, the individual will experience a significant rapid decline in cognition and communication. They may begin developing physical issues, and some people may require 24-hour care. In all stages of Alzheimer's, the changes in emotional responses are very difficult for the individual to deal with. Alzheimer's can cause increased irritability and rapid mood changes. In some cases, the individual may become distant from others or uninterested in things that they enjoyed doing before. Some people may isolate themselves from others or develop depression. Alzheimer's impacts someone's life in so many ways and really alters the way someone thinks and acts on a daily basis. Unlike a lot of other diseases and conditions, Alzheimer's presents itself with far more mental symptoms rather than physical symptoms. Psychologically, Alzheimer's is a very complex disease, and it is very difficult for the individual to cope with the sudden changes in behavior and cognition. Aside from the physiological and psychological changes an individual with Alzheimer's will experience, there are also many social and family consequences that will occur in this person's life. To begin, the next slide will talk about some of the social consequences an individual with Alzheimer's may experience. Alzheimer's disease can greatly impact a person's social life. As Alzheimer's progresses, the individual will have difficulties functioning independently. Basic tasks such as eating, cooking, bathing, dressing, and driving become a challenge. People with Alzheimer's will have to rely on someone close to them for everything. Since they cannot do things on their own, they tend to isolate themselves from their social life. Being unable to drive and get ready in the morning by themselves means they usually don't go out on their own. They have to fully rely on somebody else to go out and socialize. Another reason for isolation is memory loss. When people have Alzheimer's, it is common for them to forget people they once knew, including family and friends. This can be scary for the individual as there are so many unfamiliar people and places. So people with Alzheimer's tend to not socialize as much and isolate themselves from others. These social consequences can be extremely frustrating for the individual as they have lived a perfectly normal life up until this point. The new need for care may make them feel helpless and useless at times. On the next slide, I'm going to be talking about some of the consequences that the family of an Alzheimer's individual may experience. Alzheimer's disease greatly affects an individual's life as well as people close to them. Family and friends of individuals with Alzheimer's will have to overcome many challenges as it is a big adjustment to get used to. Taking a look at how Alzheimer's affects a person's ability to perform everyday tasks, caregivers adopt many responsibilities in taking care of their loved one. To accommodate their loved one's need for care, they may have to make changes to their own lifestyle. This can be things like changing jobs, staying home instead of going out, and other lifestyle modifications that allow for them to be home as much as possible. Caregivers will spend most of their time at home so that they can help the person with Alzheimer's at all times. The inability to care for themselves and perform basic tasks such as cooking, dressing, eating, bathing, and driving make independence an issue. As a result, caregivers commonly isolate, and their devotion to caring for their loved one may take away from their own quality of life. Patience is a very difficult thing in these situations as the caregiver is normally under a lot of stress taking on all the additional responsibilities. It is common for caregivers to burn out after a while and socially isolate themselves, sometimes leading to depression. Even though caregivers may feel mentally exhausted, there is guilt that comes with putting their loved one into a nursing home. So, many caregivers decide to continue providing care to their loved one instead of reaching out for help. This can be very hard in a lot of ways, and if a balance is not achieved, the caregiver will continue to do everything alone before experiencing caregiver burnout. There are many treatment options available that can help to slow the progression of Alzheimer's disease. In the next few slides, we will go over what some of those treatment options are and how they work. Alzheimer's disease can be managed with various medications. It is important to note that pharmacotherapy does not cure the disease itself, but is rather used to slow down the progression of Alzheimer's. The most common classification of drugs used to treat Alzheimer's disease are acetylcholinesterase inhibitors. Although these drugs have limited success, they can help to preserve cognitive function as much as possible and prevent any additional declines in cognitive function. Some examples of acetylcholinesterase inhibitors prescribed to treat Alzheimer's disease are donepezil, galantamine, memantine, and rivastigmine. These medications help to stop the progression of Alzheimer's and improve memory in people with the disease in mild to moderate stages. Acetylcholinesterase inhibitors work by enhancing the effects of acetylcholine in neurons in the brain that have not yet been damaged. Acetylcholine is a major neurotransmitter in the hippocampus, which is responsible for memory and learning. When neurons are lost through cerebral atrophy, acetylcholine is unable to act on as many neurons, resulting in a decline in cognition. When taking acetylcholinesterase inhibitors, the enhanced effects of acetylcholine will help to preserve and improve behavior, cognition, and the ability to perform activities of daily living. Aside from acetylcholinesterase inhibitors, there are other options when it comes to the pharmacological management of Alzheimer's disease. Disease-modifying drugs can be used to target the underlying cause of the disease. Currently, the only approved disease-modifying drug used to treat Alzheimer's disease is aducanumab, which is a human antibody or immunotherapy that targets the protein beta-amyloid and helps to reduce amyloid plaques, which are lesions in the brain associated with Alzheimer's. Unlike acetylcholinesterase inhibitors that enhance the effects of acetylcholine, aducanumab only acts on the beta-amyloids to reduce the number of amyloid plaques. Too many amyloid plaques in the brain cause tissue loss and cell death. By removing existing plaques and preventing new ones from forming, disease-modifying drugs such as aducanumab will improve thinking, memory, learning, and behaviors. Although medications are commonly prescribed to slow the progression of Alzheimer's disease and treat symptoms, other forms of therapy may also be offered to the individual. To begin, cognitive therapy may be considered, which focuses on addressing cognitive deficits through exercises that target specific cognitive functions in order to improve cognitive functioning. Cognitive therapy exercises may include training on basic life skills, hands-on practice of standardized tasks, and memory exercises. Memory exercises allow the brain to remain active and preserve the function the individual has left. Aside from cognitive therapy, occupational therapy may also be offered and focuses on adapting lifestyles to accommodate the cognitive decline. Occupational therapists will work one-on-one with Alzheimer's patients and will help them figure out how to perform daily tasks. By doing so, the individual will be able to continue engaging in activities and will live a somewhat normal life. As paramedics, we encounter many challenges on the road. Alzheimer's disease does present paramedics with additional challenges they must overcome in different aspects like communication, treatment, and many more. In the next slide, I'm going to be going over some of the challenges you may experience on the road as a paramedic while dealing with a patient who has Alzheimer's disease. Paramedics attend calls for patients with Alzheimer's regularly. Just like any other patient, we must perform a full assessment, gather a thorough history, and treat the patient's presentation appropriately. However, Alzheimer's disease presents paramedics with new challenges to face in aspects like communication and patient management. As paramedics, we face problems when it comes to history gathering with Alzheimer's patients. It is our job to ensure we get an accurate history, and that can be difficult if the patient does not have the capacity to answer for themselves. To overcome this challenge, we can talk to a family member or close friend to obtain a more accurate incident and patient history to ensure we have everything we need before leaving scene. If there is no one reliable on scene, we can look for medication packs, medical documents, and care packages to tell us more information about the patient. Paramedics have a responsibility to ensure their patient has the capacity to answer for themselves. This is especially important while dealing with Alzheimer's patients, as it can be dangerous to not have access to accurate information. By evaluating the patient's capacity and gathering information from family or friends, paramedics can overcome the challenge of history gathering with Alzheimer's patients. Additionally, Alzheimer's patients may have difficulty communicating with paramedics. Due to the decline in cognition, Alzheimer's patients often experience confusion, which can make them scared or in some cases aggressive. It is important to explain everything to Alzheimer's patients and try to help them understand the situation as best as they can. As paramedics, we must have patience with all of our patients. However, we must be extra patient and attentive when it comes to treating patients with Alzheimer's. Patience with these patients will help to build trust and rapport. It is common for Alzheimer's patients to get frustrated when they cannot remember things. To overcome this, we must ensure them that it is okay, not make them feel bad about it, and move on. Working with a patient experiencing confusion is difficult, as you may have to repeat yourself often to get a message across. As paramedics, we shouldn't get frustrated, but instead answer each time with a smile to help the Alzheimer's patient feel safe and understood. Some patients with Alzheimer's tend to use aggressive behavior in stressful situations. It is important to be careful and always observant of scene safety while also ensuring we treat the patients with dignity and respect. The most important thing to remember during these calls is to treat these people like real people and allow them to feel safe. Although calls for patients with Alzheimer's disease can be difficult, these challenges can be overcome with kindness, adaptation, and lots of patience. In conclusion, Alzheimer's disease has several impacts on an individual's daily life. The inability to think effectively, make decisions, and perform daily tasks on their own results in an increased dependence on people close to them. As a result, individuals with Alzheimer's typically isolate themselves socially, and people close to them suffer consequences as well. With the right treatment, whether it be pharmacological or therapy, the progression of Alzheimer's can be slowed down and behaviors can be managed. Having a good understanding of the disease itself and how individuals with Alzheimer's act and cope with various things is important as paramedics. We must have the necessary knowledge so that we can communicate with these patients effectively and provide care with kindness, dignity, and respect as we would with anyone else. Overall, Alzheimer's is a very complex disease, and by communicating effectively and using lots of patience, we can make a huge difference in these individuals' days. I wanted to thank you again for taking the time to listen to my presentation today. If there are any questions that you have regarding any of the content that I have covered, feel free to reach out and I will do the best I can to answer any questions you may have. Thank you.